Do your joints creak or your bones feel unusually fragile? These could be signs that your bone health needs immediate attention. Let's explore how to keep your bones strong and avoid life-altering fractures. Bone health is the foundation of physical stability and mobility, yet it often goes unnoticed until a problem arises. Understanding why bones weaken is the first step to preventing fractures and ensuring lifelong strength. Bones are living tissues that constantly renew themselves through a process called remodeling. During this process, old bone tissue is broken down and replaced with new tissue. However, as we age, this balance shifts. The body starts losing bone mass faster than it can be replaced, leading to weaker and more brittle bones. One of the primary factors affecting bone strength is age. Bone density peaks in your 20s and 30s, after which a gradual decline begins. Women, especially after menopause, face an accelerated loss of bone mass due to the drop in estrogen, a hormone crucial for maintaining bone density. Men are not exempt. Their bone health can also deteriorate with age, though the process is often slower. Lifestyle choices play a significant role in bone health. Poor dietary habits, particularly diets low in calcium and vitamin D, deprive the body of essential nutrients required for maintaining strong bones. Calcium is a critical building block of bone tissue, while vitamin D helps the body absorb calcium efficiently. Without these, bones become porous and more prone to fractures. Physical inactivity is another key contributor. Bones require regular weight-bearing exercises such as walking, running, or resistance training to maintain their density. A sedentary lifestyle can accelerate bone loss, making fractures more likely. Similarly, habits such as smoking and excessive alcohol consumption negatively impact bone health by interfering with the body's ability to absorb calcium and produce healthy bone tissue. Finally, certain medical conditions such as osteoporosis, rheumatoid arthritis, and thyroid disorders, as well as long-term use of medications like corticosteroids, can compromise bone strength. These factors often interact, further increasing the risk of fractures, especially in older adults. By understanding the causes of bone weakening, individuals can take proactive measures to preserve their bone health. Early interventions such as improving diet, exercising, and addressing medical conditions are vital for maintaining strong and resilient bones. Bone health issues often develop silently, with no noticeable symptoms until a fracture occurs. This is why it's essential to recognize early warning signs that may indicate your bones are weakening. Paying attention to these subtle cues can help you act before a more serious problem arises. One of the most common signs of declining bone health is joint stiffness or creaking sounds, especially when moving. While not always directly linked to bones, these sensations may indicate wear and tear in the skeletal system or joints, which could indirectly affect bone stability. If these symptoms persist or worsen, it's worth investigating further. Frequent fractures are another critical indicator. If you find that minor falls or accidents are resulting in broken bones, it's a clear sign that your bone density may be low. This is particularly common in the wrist, hip, and spine, the areas most vulnerable to fractures in conditions like osteoporosis. A loss of height or a stooped posture is another red flag. Over time, weakened bones in the spine can compress or collapse, leading to a noticeable reduction in height. This condition, known as vertebral compression fractures, often causes back pain and a hunched posture. If you notice any of these changes, it's important to consult a healthcare provider. Persistent pain in the bones or muscles, especially in the back, hips, or legs, can also be an early sign of bone weakening. While bone pain isn't always directly linked to fractures, it could signal underlying issues such as calcium deficiency or bone stress. Additionally, brittle nails or weakened teeth might point to poor bone health. Nails and teeth share structural similarities with bones and rely on similar nutrients, like calcium, for their strength. Weakness in these areas could signal broader deficiencies affecting your skeletal system. Lastly, fatigue and overall weakness might not immediately seem connected to bone health, but they often accompany deficiencies in calcium or vitamin D, both essential for maintaining strong bones. Recognizing these signs and seeking professional advice early can make a significant difference in preserving bone strength. Timely intervention, whether through lifestyle changes, dietary improvements, or medical treatments, can help prevent further deterioration and reduce the risk of fractures. A well-balanced diet is a cornerstone of strong and healthy bones. Nutrition directly impacts bone density, structure, and overall resilience. Ensuring your body receives the necessary nutrients can help prevent conditions like osteoporosis and minimize the risk of fractures as you age. Calcium is the most crucial nutrient for bone health. Approximately 99% of the body's calcium is stored in the bones, making it an essential mineral for maintaining their strength and structure. Adults typically require 1,000 to 1,200 milligrams of calcium daily. Excellent sources include dairy products like milk, yogurt, and cheese, as well as plant-based options such as fortified almond milk, tofu, kale, broccoli, and almonds. Equally important is vitamin D, which allows the body to absorb calcium effectively. Without sufficient vitamin D, even a calcium-rich diet may not be enough to maintain bone health. Sunlight is a natural source of vitamin D, but dietary sources such as fatty fish, salmon, mackerel, sardines, egg yolks, and fortified cereals are also valuable. Supplements may be necessary for individuals with limited sun exposure or absorption issues. Other nutrients also play vital roles in bone strength. Magnesium supports calcium absorption and is found in nuts, seeds, whole grains, and green leafy vegetables. Vitamin K, present in foods like spinach, Brussels sprouts, and parsley, contributes to bone mineralization, ensuring calcium binds to bones effectively. Protein is another essential component as it provides the building blocks for bone tissue. However, balance is key. While insufficient protein intake can weaken bones, excessive amounts might lead to calcium loss in some individuals. Aim to include lean protein sources like chicken, fish, legumes, and eggs in your meals. Acidic diets, often high in processed foods, sugars, and sodas, can lead to calcium leaching from the bones to neutralize the body's pH. Reducing these foods and prioritizing whole, nutrient-dense options is critical for bone health. Hydration is often overlooked but equally important. Staying hydrated helps maintain joint lubrication and supports the metabolic processes involved in bone remodeling. Lastly, alcohol and caffeine should be consumed in moderation. Excessive alcohol interferes with bone formation, while high caffeine intake can impede calcium absorption. By focusing on a nutrient-rich diet and avoiding harmful substances, you can build and maintain strong bones at any stage of life. Simple dietary changes, paired with healthy habits, form the foundation for a resilient skeletal system. Preventing fractures and maintaining strong bones goes beyond nutrition. Your lifestyle choices play a significant role in supporting skeletal health. Simple but effective changes can dramatically reduce the risk of fractures and improve overall well-being. 1. Regular physical activity. Engaging in weight-bearing and strength training exercises is one of the most effective ways to maintain bone density. Activities such as walking, jogging, dancing, and hiking stimulate bone remodeling by placing stress on the bones, encouraging them to strengthen. Strength training with weights or resistance bands helps build the muscles that support your bones, reducing the likelihood of falls and fractures. Balance-focused exercises like yoga and Tai Chi improve coordination and reduce the risk of falls, especially in older adults. 2. Quit smoking and limit alcohol. Smoking has a direct negative impact on bone health. Nicotine and other chemicals in cigarettes impair bone-building cells, reducing bone density over time. Quitting smoking can significantly improve bone remodeling and overall health. Similarly, excessive alcohol consumption interferes with the body's ability to absorb calcium and slows bone regeneration. Reducing alcohol intake to moderate levels, no more than 1 drink per day for women and 2 for men, is essential for maintaining bone strength. 3. Create a safe home environment. Falls are a leading cause of fractures, particularly in older adults. Prevent accidents by ensuring your home is free of tripping hazards. Remove loose rugs, ensure adequate lighting in all rooms, and install grab bars in bathrooms. Wearing supportive footwear with non-slip soles also reduces the risk of slipping. 4. Prioritize sleep and stress management. Chronic stress and poor sleep can disrupt hormonal balance, including cortisol levels, which affect bone remodeling. Incorporating relaxation techniques such as meditation, deep breathing, and mindfulness can help manage stress. Aim for 7 to 9 hours of quality sleep each night to support your body's natural repair processes. 5. Maintain a healthy weight. Both underweight and overweight individuals face challenges with bone health. Being underweight can lead to lower bone density, increasing the risk of fractures. On the other hand, excessive weight puts additional stress on weight-bearing bones and joints, potentially causing wear and tear. Maintaining a healthy weight through balanced nutrition and exercise is crucial. 6. Avoid overuse of medications. Certain medications such as corticosteroids can weaken bones when used long-term. If you rely on these medications for chronic conditions, speak with your doctor about strategies to protect your bone health, such as supplements or alternative treatments. Adopting these lifestyle changes not only strengthens bones but also enhances overall quality of life. Small, consistent efforts can yield significant results, allowing you to maintain independence and avoid debilitating fractures. While nutrition and lifestyle changes are crucial for bone health, medical solutions often play a vital role in preventing and treating bone weakening, especially for individuals at higher risk of fractures. Understanding the available therapies can help you make informed decisions with your healthcare provider. 1. Bone density testing. A bone mineral density (BMD) test, such as a DEXA scan, is a non-invasive method to assess your bone health. This test measures the density of bones in areas prone to fractures, like the hip and spine, helping to diagnose osteoporosis or determine fracture risk. If your bone density is low, your doctor may recommend specific treatments to prevent further loss. 2. Calcium and vitamin D supplementation. When dietary intake is insufficient, calcium and vitamin D supplements can be essential. Calcium supports bone structure, while vitamin D enhances calcium absorption and helps maintain bone density. These supplements are often prescribed in combination, tailored to meet your individual needs. 3. Prescription medications. For individuals with significant bone loss or high fracture risk, medications may be necessary. The most common options include bisphosphonates. These drugs slow bone breakdown, allowing the body to rebuild bone tissue. They are typically prescribed for osteoporosis and are available as oral or injectable treatments. Selective estrogen receptor modulators, SERMs. These mimic the effects of estrogen on bones, slowing bone loss in postmenopausal women. Parathyroid hormone analogs. Medications like teriparatide stimulate new bone growth and are used for severe osteoporosis. Monoclonal antibodies. Denosumab is an injectable option that reduces bone resorption and increases bone density. Your doctor will assess your medical history, fracture risk, and preferences before recommending a specific treatment. 4. Hormone replacement therapy, HRT. For postmenopausal women, hormone replacement therapy can help maintain bone density by supplementing estrogen levels. While effective, HRT carries risks such as an increased likelihood of blood clots or certain cancers. Discussing these risks with your doctor is essential. 5. Physical therapy and rehabilitation. For those recovering from fractures or looking to improve balance and strength, physical therapy can be invaluable. Therapists design personalized exercise programs that target weak areas, improve posture, and enhance mobility, reducing the risk of future injuries. 6. Innovative treatments. Emerging therapies such as anabolic agents and gene therapies are under development to further enhance bone growth and density. These cutting-edge treatments may offer new hope for individuals with severe bone conditions in the future. 7. Regular monitoring. If you're undergoing treatment for bone loss, regular follow-up appointments and repeat bone density scans are necessary to evaluate progress. Adjustments to your treatment plan may be needed to ensure optimal results. Medical solutions, when combined with a healthy lifestyle, provide a comprehensive approach to bone health. Collaborating with healthcare professionals ensures you're taking the right steps to protect your bones and reduce the risk of debilitating fractures.